the Liberal government is coming under fire for their, quote, safer supply program. That's a program that says it will help addicts get a safer supply. And this could be a solution to Canada's drug crisis. Now, journalist Adam Zivo has taken a look at this program, and his findings suggest that the government's actions could actually be fueling a new opioid crisis. In a piece for the National Post, he details how drugs handed out for free are actually being sold on the black market to fund fentanyl addictions. Now, safe supply advocates have long said, that this is a solution to Canada's addiction crisis. And they also say that this program is working. But let's find out what the truth is behind Canada's Safer Supply program. Adam Zivo, columnist for the National Post, joins us on the line. Hi, Adam.
Hi, nice to see you.
Yeah,
Thanks
nice.
for having me.
Yeah, it's great to talk to you here, Adam. So first off, why did you say, hey, because your work in the National Post, this is a lengthy piece here. Why did you say you needed to take a look at Canada's Safer Supply program?
Well, so I write a lot about homeless violence in Toronto because I lived beside an encampment back in 2020, and that was pretty horrific. And through that writing, I was approached by a guy named Dr. Julian Summers, who spoke to me about how he had criticized Safer Supply and how criticism of Safer Supply was being suppressed. So I did an op-ed about that, which was published in the very beginning of January, and I saw what the response was. I saw the harassment from Safer Supply advocates, and I received a large number of contacts from other addiction physicians who said that this is actually a serious issue. So I decided to do an investigation. It was supposed to be one story, and then it grew and grew and grew. It was like pulling on a chain, and the scandals were never ending. So it turned into this 10,000 word behemoth.
So, you know what, for our listeners here, why don't you tell our listeners just what is exactly is happening with this Safer Supply program? What does it promise to do? What is it actually doing?
So here's the thing. Safer Supply is supposed to reduce overdoses and deaths by providing drug users with a predictable source of, I guess, drugs, in contrast to the toxic illicit market. So, for example, if you buy a drug off the street, it could be laced with fentanyl. Who knows what could be in it? It can kill you. But if you get a prescription opioid from the government, then that should be fine. Now, in actuality, what's happening is that the government is giving something called hydromorphone, which is a prescription opiate about as powerful as heroin. And that drug, as powerful as it is, doesn't get fentanyl users high because fentanyl is incredibly powerful and it gives people an incredibly high opioid tolerance. So fentanyl users essentially pick up their free government-funded hydromorphone and they sell it on the street at rock bottom prices to fund the purchase of additional illicit fentanyl. So Safer Supply isn't mitigating fentanyl use, it's actually subsidizing it. And then this floods communities with hydromorphone, causing the street price of the drug to go down by 70 to 95%, which is now creating a new wave of addictions, particularly amongst youth and those struggling in recovery.
Adam, you know, I've always likened myself as a progressive. And you mentioned off the top that sometimes now the advocates for this Safer Supply program, you say anything to question this program, they come at you hard. So let's talk a little bit about that, because I find myself looking at these programs across the country. I don't see any evidence of them working. And if you question them, you get into trouble. Let's talk about that aspect of things.
Well, so one thing that's important to understand is that the majority of addiction medicine practitioners are actually hostile to Safer Supply, but they're too afraid to speak out because a small number of very aggressive advocates / activists bully anyone or threaten their livelihood if they criticize Safer Supply. Dr. Julian Summers, who I mentioned earlier, is a great example of that. He was subject to a smear campaign. I was subject to a smear campaign once I started tweeting stuff that was critical of Safer Supply. And it's really unfortunate because the narratives that are employed by these Safer Supply advocates are so divorced from reality. They say, for example, that criticism of Safer Supply is an alt-right conspiracy, which I found to be absurd, given that the most vocal critics that I've interviewed of Safer Supply tend to be NDP voters, or I guess like NDP aligned physicians.
Mhm. We're with Adam Zivo, columnist for the National Post, talking about Canada's Safer Supply Program, as it's called. So, Adam, what have been the results? Are people dying, or addicts dying, because of this Safer Supply Program?
Well, it's hard to say for sure. And the reason why it's hard to say is that addiction physicians who try to crunch the data to track negative impacts of safer supply simply aren't allowed to do so. One of my interviewees volunteered their time at an institution. Well, they worked at an institution associated with safer supply, and they volunteered to crunch the data to measure negative impacts. And they were essentially threatened with their job. They were told that they would not be welcome at the institution if they continue with that project. So the problem is that we don't have the data to fully substantiate our claims, but only because that kind of research is being suppressed.
Hmm.
What I can say is that it's not, it's likely that people aren't dying en masse from hydromorphone because it's not powerful enough for that per se. But people are dying because hydromorphone then leads to fentanyl use.
Mm-hmm. And do you think the government's pretending that it's working? Like, why would the government, if there are indications that this program isn't working as intended, why is the government continuing to move forward with it?
Well, there's two reasons. So the first reason is that there's a clique of BC-based researchers who produced a lot of shoddy research that gives the impression that safer supply works when it doesn't. And many of the leading policymakers in BC and at the federal level are part of that clique or closely aligned to it. So they actually believe this is working, even though it isn't, because they've been, in a sense, manipulated and hoodwinked. On top of that, there's a level of political investment. The federal government has really aligned itself with this program. It would be highly embarrassing if it were to be discovered the program doesn't work. Now, I know as a fact that Health Canada is aware that safer supply doesn't mitigate fentanyl use because they published a report in March of 2022 that acknowledged that very fact. That report said explicitly that hydromorphone has almost no effect on fentanyl users, so fentanyl users continue to use fentanyl on the streets. But for some reason, that finding is omitted from all the federal government's messaging on safer supply.
There's a quote in your piece, Adam. 100% of all of the people I've met who are on safer supply sell their safer supply. I've never met anybody who's taken all of it. They may take their safer supply as a bridge until they get their drug of choice, but nobody that I know in the history of me meeting people, well, they all sell and divert it. That quote from your piece is an eye-opener here. Are there any indications that somebody in the government, somebody in charge of things, could be opening their eyes to this reality?
Honestly, no. I mean, I saw the response to my report by the federal government over the past 2 days. Poilievre, he brought it up in question period yesterday, and Trudeau avoided addressing any of the specific claims made in my report and just accused Poilievre of engaging in fear mongering. And Trudeau said, we must listen to frontline experts. And the ironic thing is that my report is based off the testimony of frontline experts. So who here is actually listening to the right people? Who here is doing what they're claiming to do? On top of that, so Minister Carolyn Bennett, she's the Minister of Mental Health and Addiction. She's the primary person responsible for this. She's doubled down and has accused Poilievre of sharing false information, ergo accusing my report of being inaccurate, but she hasn't provided any specifics as to what she believes is inaccurate. And she's continued to ignore the fact that her own department says that safer supply doesn't work for fentanyl users.
Adam, they do these types of programs in other parts of the world. Maybe they have some data. Or are there differences to the program? Because I hear this all the time. Oh, they're doing this in this country and it's working. Can you add anything on that? Like, what do we see from other countries that either Canada can learn from or change?
Well, here's the thing, is that safer supply has been implemented successfully in other countries because they do it much more responsibly than what we do. So in Switzerland, safer supply appears to be working, and that's because they have a very high barrier to entry. So it's not as if anyone can just enroll in safer supply. And on top of that, you cannot take your safer supply home automatically. You have to have a trusted relationship with your doctor. You have to earn that. In Canada, what we've done, which is unique, is we focused on lowering barriers. and making safer supply as easy to access as possible, which means that anyone can access it. They just have to say they've overdosed in the past 6 months or so, and you can take it home right away. And that's the problem. When people can easily take safer supply home with no accountability, it gets sold on the streets. And no other country does that.
Adam Zivo is a columnist for the National Post. Adam, thank you so much for coming on the program this morning.
Thank you for having me.
You can follow Adam, by the way, on Twitter @ZivoAdam if you want to find out more on his reporting.